Good morning. First, thank Dr. Julio Montana take leadership to organize this important workshop. I also like to thank NIDA to support my participation in this workshop. So I'm going to talk about China's perspective, more focused on what we need from regarding treatment as prevention. Here I show you a few slides about our premier. Since he became premier in the 2003, every year he participated at campaign. So these slides just tell us, once the politician care about HIV/AIDS, that makes life much easier when we translate science to policy. In the past few years, we made remarkable achievement, particularly when we scale up ART that dramatically reduce the mortality. And also in terms of health service for HIV-infected individuals, the coverage and service improved significantly. In terms of medical maintenance, we scaled up very quickly, and incidence among drug users continuing to decline. Even in the past year, incidence among drug users further declined by 26% compared to the year 2010. The epidemic continued to evolve. Heterosexual transmission become major mode of transmission now. It's accounted for over 63% of newly reported cases. However, we still face tremendous challenge, particularly increased number of AIDS deaths. When we talk about mortality, the coverage of ART is critically important. We compare the ART coverage in 3 provinces, Henan, Guangxi, and Guangdong. So once the coverage, when we talk about mortality, particularly among people already in the ART, in the bottom line, the mortality almost the same in the 3 provinces. However, because of coverage ART different in the first line, so we have 85% in the Henan, 75% in Guangxi, and 52% in Guangdong. The overall mortality differed significantly. In Henan, only about 9%, and in Guangxi, increased to 26%. In Guangdong, it further increased to 36%. The coverage makes really difference. Let me transfer to another topic about incidents, particularly HIV transmission. In the 2009, we made estimation jointly with WHO and UNAIDS. Among sexual transmission, I read the bottom line, of this infected through heterosexual transmission, about 1/3 were infected through spousal transmission. That highlights the HIV transmission among couples are significant portion in the overall transmission. We have contact tracing. Once we identify HIV infection, we immediately contact their sexual partner. Once they are tested for HIV, almost 50% already infected. Even worse, when we talk about discordant couple, I compare 3 provinces that are heavily affected by HIV. Nationwide, the average HIV incidence, or we call it seroconversion, among discordant couples in the 2010, 5.5%. In Henan, 5.7%. In Guangxi, 6.5%. In Yunnan, 7%. That's extremely high. Why is that? Because of a culture issue, religious, social norm, particularly in the minorities. And also for the elder or senior men, they're not able to use condom. If they use condom, they cannot make love. So condom is effective, however, it is very difficult to promote among couples, even more difficult to promote in the minority group, because they believe sex is a gift sent by God. We cannot intervene. Another group, it's a challenge we face. Men have sex with men. If we monitor the epidemic, among other groups, it's stabilized or declined. However, among men have sex with men, it's continuing to increase. With support from the Chinese government, we conducted a cohort study among men have sex with men in the 8 cities. The highest incidence is in the right 3, it's in the Guiyang, 15.7%, the incidence of HIV infection. The lowest is in Kunming in 3.2%. So the average is about 5% of incidence among men have sex with men. That is similar to the incidence among discordant couples. Why so high of incidence among men have sex with men? They already have sufficient AIDS knowledge. They know how virus is transmitted, how to protect. However, they continue to engage risk behavior. They continue to have high incidence. Another group is also a challenge. I'm not sure in the other countries, it's particularly in China, we are aware it's a significant change. Men over 60 years old, the number of HIV infection, number of AIDS continue to increase in the past few years. This group is also difficult to change their behavior. They know how HIV transmitted, and also he knows the 10-year of incubation period. When you talk to them, you need to care about yourself. He said, I know. I already 6 years old. After 10 years of incubation, when I'm ill, I'm already 70 years old. That is about average of life expectancy. So that's enough. So that makes it also difficult to have intervention program. Just 2 months ago, Chinese government issued new policy paper, 5-year action plan. We aim to reduce incidence by 25% and mortality by 30%. Given 3 population groups I just present to you, what can we do? Behavioral intervention does not work, at least not work that as we expected in these 3 groups. That's why we need treatment. Need treatment as treatment. Particularly, we need treatment as prevention, particularly for these 3 groups. They have knowledge, but they cannot change their behavior. We need biological strategy. In terms of implementation of treatment of prevention, this is just Chinese perspective. We talk about strategy. It is okay, it is fine, it is acceptable. When we implement, it is fine, it is okay. However, it's not good to do campaign for treatment and prevention. You do policy advocacy, that's okay. When you do campaign, at least 2 things we need to consider. We may be misinterpreted. The first misinterpretation is when you talk about treatment as prevention, people may say, you emphasize treatment as prevention, you ignored other strategy. Because treatment is very expensive. At least people perceived. The more important, HIV-infected individuals, the communities, they said, why I take treatment? I take treatment for benefit others, not benefit immediately for myself. Why I need to take ART? ART has severe side effects. It's not that tolerable, particularly when you have the first-line medicine. So we must be careful to do treatment as a prevention. Thank you.